Welcome friends to CNS Viewpoint. Today we are going to talk about something very alarming I read in one of the documents on WHO website, the World Health Organization website, that over 120 countries are administering boosters currently, and 126 countries are such that have had a booster as part of the national recommendations. And this is really alarming. Also, more so because this is, if I am not wrong, this is December 2021 dated document, and WHO had called for a global moratorium on administration of boosters, so that vaccines can be rolled out first to people who do not have received even first dose of the vaccine, and only then, if the scientific evidence is strong enough, WHO would have recommended boosters. And of course, I think there was some recommendation or thought on administering boosters to people or group of people who have, like, for example, immunocompromised people, people with comorbidities, etc., who had where there is some evidence to show that they might have lower protection with time due to vaccines. But by and large, mass administration of boosters till end of December 2021 was not recommended by WHO, and even now it is not recommended by the World Health Organization. Booster is for only those population where there is a risk that the protection due to the vaccines will decline with time, may have declined with time. And we have to realize that most of the people who are getting hospitalized in richest of the rich nations, as well as in poorest of the poor nations, due to in the Omicron wave, are those who are not vaccinated. So, for example, 90% WHO experts had said in early January 2022 that 90% of the people who are hospitalized are unvaccinated. Dr. Tom Frieden, who is a former director of Centers for Disease Control and Prevention, CDC, had said that 99% of the young people under 18 are not vaccinated. So I think, if I remember correctly, even Mumbai experts had said that majority of the people who are in hospitals due to COVID-19 are unvaccinated. So it is clear the risk which being unvaccinated poses, and people are not unvaccinated. It is the vaccines. It is our failure of not ensuring that vaccines are not reaching the arms where it should. We have been successful in offering vaccines to every human being who is eligible for them on the planet in an equitable manner, in a time-bound manner, and rather in a selfish attitude, we have been jabbing booster after booster. There are countries which are jabbing fourth round of vaccines, which means second booster, like Israel and Germany, for instance. So coming back to what I had read, so 120 countries were administering booster, 126 had booster in the recommendation, and this is despite and in spite of WHO moratorium call till end of December 2021 not to give booster. And several of these countries which were administering boosters had less than 30% of their population which was fully vaccinated. So full vaccination rate in the population was less than 30% in several of these nations which were actually administering boosters. Just imagine the situation. And if you see that 109 countries out of 193 had also failed to meet 40% fully vaccination target of the WHO in their population by December 2021. So 109 countries failed to meet 40% full vaccination rate in their populations out of 193, but 120 countries out of 193 were administering boosters. So it is very clear that a lot of countries which had not reached even the target of 40% or 30%, as WHO site also says, they were administering booster doses. So this really, speaks volumes about the fact that we have failed again. It's very disappointing that we failed again to keep social justice, equity, and reason, science, evidence as the central drivers to rolling out vaccines and other social and public health measures which are necessary to tide through COVID-19 pandemic. But also these are necessary for a broader health response, so that each one of us can enjoy health security. So let us hope that although I really have to say I don't see much hope, but let us still hope that we will see a different COVID response, which is more rooted into principles of equity, justice, and where health will take precedence over profits and over unscientific or lack of evidence-based measures. So hoping for more saner times. With these words, I will conclude today's CNS Viewpoint. And tomorrow again at 5 p.m, we will be back with our thoughts and views and perspectives on something that made us think. Sorry, bye till then. Wear your mask, stay safe, stay healthy. Bye-bye.